the mom.
How you guys doing today? My name is Brian Clark. I'm a personal trainer. I've been training for about 15 years, all right? And I'm going to tell you a little story about a person I trained when I first started, well, about 10 years into it. His name was Joe. And so Joe was a 75-year-old man, and prior to me meeting him, he'd fallen down an elevator shaft. When he fell down the elevator shaft, he broke his hip, jacked up his knee, and during that time, there was nothing, there was not a whole lot of physical therapy. So, and it's still in its infancy. So Joe had gone through many years dealing with this, not getting appropriate physical therapy, and then going into a sedentary lifestyle. When I met Joe, right, so this is 30 years later after the accident, Joe's sitting here and he looks kind of like he's walking like the Walking Dead. His torso is contorted, his foot's dragging behind him because he's got all these compensations that he's dealing with because he never got appropriate physical therapy. On top of that, Joe had hyperlipidemia, high blood pressure, diabetes, and was cardiovascular disease. So because of his inactivity. So he told me, he said, hey, Brian, I was told by my doctor to come down here and I need to train. I need to make a serious change in my life because I have cardiovascular disease, but I don't know what to do because of these injuries. And so I said, you know, we're going to work through these. So the first few months, we basically just did stretching. I gave him fascia release, things like this, just so that he could move and get the proper range of motion when we worked out. Over the first few months, he lost about 12 pounds, right? And we were able to rehab pretty well his leg. It took us about a whole year to rehab his leg, but over the whole year course of time, another thing had changed. Since I got him moving again, Joe no longer had hyperlipidemia, he no longer had diabetes, and he no longer had high blood pressure. Now, like I said, I've been personal training for about 15 years. Over the course of time, I've gotten multiple certifications, such as a corrective exercise specialist, which I utilize with Joe, a performance enhancement specialist, a nutrition specialist, and a few others. Currently, I'm about 3 months away from getting my degree in exercise science. And so today, we're going to talk about obesity and how it correlates to cardiovascular disease and any other diseases related to that. And for adults, obesity is defined as a calculated number based on the body mass index. So it's anything greater than 30%.
Is what considered obese?
It's considered obese. So if a person is 30% or greater on the body mass index, they're considered clinically obese. If they're 25 to 29.9%, this is overweight. All right. There's another thing because the body mass index does not always correlate with the athletes. A person who's athletic may be overweight, but they're not over fat.
Right.
So we also do body fat testing, right? For body fat testing is, for males, anybody who's over 22% of their body weight is considered obese. And for females, 34% and above is considered obese and or overweight. Okay? Today's population, as you guys know, there's a high risk of cardiovascular diseases and comorbidities directly related to obesity. Personal trainers can actually provide a key role as to part of the solution, right? By providing a program that'll directly deal with this, deal with their weight, and give them high quality programs that will lead to success in both physical and physiological changes. All right, and that's important. The body actually carries fat in a couple of different ways. We have two different ways. Specifically, you have visceral fat, which is organ fat, right? And everybody has it. And then we have subcutaneous fat. And as you know, since there's fat cells around your organs, if you get the more overweight, there's no choice. You have no choice on it. You're going to grow subcutaneous fat, so outside you're going to get more fat on you, as well as your organs are going to get larger. And what happens when your organs get high amounts of fat on them? They're not going to perform and do as well as they're supposed to. So the statistics in America, right? There is a longitudinal study over 3 decades provided by the University of Memphis, Tennessee. And in the 1990s, there's a study. This is when they started studying. And in the 1990s, about 12% of the population was clinically obese and or overweight. They did it again in 2005 and had increased to 23% of the population clinically obese and or overweight, right? Currently, the statistics, it fluctuates, but it's right around 30% of the population currently. The total population is considered obese and or overweight. All right. Now, as we know, obesity, there's a direct correlation to heart disease, right? 30% of heart disease is attributed to hereditary. So you're genetically pre-programmed to have a higher inclination to having some sort of cardiovascular disease or something associated with that. That's 30%. But 70% is directly correlated to obesity. And that was brought to you by the Nutrition Committee of the American Heart Association. And there's a study by Dr. Darren Wattsburn of the Cardiovascular Physiology and Rehab of University of British Columbia. And basically, they were able to confirm that diet and exercise have irrefutable evidence as a primary and secondary prevention of obesity and chronic diseases that are directly associated with that. All right. So has anybody heard of Biggest Loser?
Yes.
The Biggest Loser. Biggest Loser has been around for about 15 years now. This is their 15th season. The two initial trainers were Jillian Michaels and Bob Harper. Right? You guys remember? You guys ever watch any of that?
Yeah.
So here we have. Basically, you're dealing with these people that are seriously obese. We're talking 150 pounds overweight and or more. Every single of these people that went onto the show, everyone, they may not have won the show, but everyone was successful, right? They all lost something. They all lost weight. They all had changes, right? Those trainers, they pushed them. They motivated them. These people broke down. They cried. They said, I can't do it. I don't believe in myself. But the trainers, they changed that. They sit there and they pushed them. They motivated them. They held them accountable. And these people attained goals that they never knew that they could do. And now a lot of these people have done a lot more. A quote I want to go over is, the only way of finding the limits of the possible is by going beyond them and into the impossible. And that was by Arthur C. Clarke, who's a revolutionary. He's a science fiction person as well, but he's a revolutionary writer. And so when we're talking about the quote, right, a lot of people set personal limitations, and they're saying, you say, hey, I want you to go do this, and immediately the mind says, I can't do that. It's not possible. You're like, go climb that mountain. No, I can't. And by having somebody behind you, or by doing a box jump, right?
No, I can't.
By having somebody beside you, pushing you and motivating you, you achieve it because you have somebody who's there to back you, right? And that's our entire system's based on the education system. When we, from the start, you go through education, you're like, when your kids are like, I can't do this. And the teacher guides them and shows them the way. And all through society, this is how our society is built, through this teacher-mentor relationship. All right? So this is how trainers are going to help you and help your patients get their goals. Obviously, when your patients come in here, they have, a lot of them may have a cardiovascular disease, and typically, it's, the suggestion is diet and exercise, right? And here's what a trainer can do to help them with that. Number one is a food intake, all right? And these are what are called the 5 components of fitness, also known as the pillars of fitness. Proper food intake, right? So what we're talking about is energy in versus energy out, and creating a caloric deficit, right? So how much a person needs to eat, right, to get a loss, but still get enough nutrition so they're not losing muscle mass or lean body mass. Also, a proper balance in their diet, right? And this is very important. People get a lot of misconceptions how they should eat. There's a high carb diet, there's a low carb diet, there's a high fat diet, and everybody's like, what should I eat? And in today's day and age, if you go to places like 24-Hour Fitness and or Crunch or any other fitness organizations, they actually provide nutritional programs that give you, and these are designed by nutritionists, that give you a specific caloric intake to meet that person's goals safely and to balance the nutrition program. Tell you exactly how much percentage of carbohydrates you should eat, how much percent of fat you should eat, and how much percent of protein you should eat. The second one is supplementation. Does anybody know what supplementation is?
So like vitamins, like that type of supplement?
Vitamins, right? There's vitamins. There's also nutritional shakes. There's a lot of people out there who don't like to eat in the morning, right? I don't necessarily like to eat a heavy meal in the morning. This is where a nutritional shake is going to give me added nutrition without all the added calories. On top of that, when you're talking about supplementation, you're talking ergogenic aids. And this is a big thing because people don't know, like, the big fad. What's the latest fad? What's the pill to take? That's the magic pill. But what's the pill to take? Is it right for you? If you're setting something that's cardiovascular disease, right? There's trainers out there who have good knowledge as to how to properly give this person certain supplementations that's not going to have any adverse effects with any medication that they're taking. Obviously, you don't want to give somebody caffeine, right? If they're on blood pressure medicine or anything like that. So that's supplementation. The next one is cardiovascular programming, cardio training. Typically, when it comes to cardio, what do you guys know a bit about cardio? When it comes to cardio, people just think, hey, let me go get on the treadmill. I'm gonna get my heart rate up, and I'm just gonna maintain that. And there's all sorts of different ways to give cardio programs. There's basically what we're gonna do is we're gonna teach you your target heart rate, and this is where you want your heart to be beating per minute to maximize energy expenditure. All right, and then we can manipulate that. Basically, there's different programs. Instead of just getting on the treadmill and going for 40 minutes, that's boring. I don't like to do that, right? We can do things like HIIT programs, a high-intensity interval training. It's not as bad as it sounds. I actually have a guy who's in his 80s, and he does a HIIT program, and he's got bilateral knee replacement. He does HIIT program on a cycle. It's safe, but it's appropriate for him. The fourth component is resistance training. So resistance training is how to work out with weights, with the cable systems, and the appropriate workout for that person and their goals. Okay, the trainer is going to know the innovative ways and newest ways to train you. They're going to educate you proper techniques. They're going to go through different modalities of training to make sure that that person knows exactly what to do. On top of that, it's going to be different every time, as opposed to going. And most people are going to Mondays for guys are like Mondays is chest day, Tuesdays is stat day, and they stay on a specific routine. It's not that way with the trainer. It's going to continuously change. It's every time you go in there, it's going to be a completely different environment. They're going to train you, one day total body, the next day it might be just legs. They're going to implement cardio with it, but it's going to be changing. And since it's different every time, it's going to be more motivating, and that person, your patients, are going to have more fun, right? And the last is personal assistance, right? So again, working with a professional, somebody who's spent time educating themselves. There's various levels of trainers, the guy who's just starting versus the guy who's been around 15 or 20 years. But these trainers are going to motivate them, they're going to educate them, they're going to hold them accountable. And that's very important, accountability. Because if you just suggest to go to personal training, right, they're going to go over there, they're going to go to the gym. They're not working out, they're not working with the trainer, so they don't know exactly what to do. They don't have a meal plan, diet plan, they don't have a cardio plan. So within 3 weeks, there's nothing to hold them accountable to that. There's no change, and they lose interest and they leave. And as opposed to dealing with the situation, they're just taking their medication and it's just a temporary aid. All right, so how do you find a good trainer? Like I said, when a person goes to find a trainer, they should interview the trainer. Now, first and foremost, you should make sure that you like the person. Right? You're going to make sure that when you're talking with them, that you guys click, that you mesh, right? That the person's inspirational for you, right? Secondly, you want to dive into some education. See what the person's background is. How long have they been in? What experience have they been with people like your patient? How many obese people with knee replacements, hip replacements, so they can have the confidence the trainer can deal with that person. Also go through their certifications. All right. So here's the thing: the healthcare system currently, when we're talking about cardiovascular disease or diabetes, anything related to that, doctor just says, "Here's your medication, right? I prescribe your medication, and here we go. And see me in this next 6 months, and we'll make sure if we need to change your medication." While the medication does deal with it temporarily during that time, it is not going to cure the person, right? The cure is the proper medication and diet and exercise. Reduction of fat mass, which is in turn reduce chances of cardiovascular diseases. All right? So, by prescribing personal training, as opposed to suggesting it, patients, number one, if the doctor says, hey, and this is what you guys as nurses should say, doctor, did you prescribe personal training? The doctor's going to prescribe it. Person's going to actually go out there and look. Right off the bat, they're like, you know what, my doctor said I need to go train. So right off the bat, they're going to go in there and they're going to investigate it. They're going to go to a gym. They're going to have a higher chance for success. They may need a trainer. They may not. But they're going to have a higher degree of success because they're going to go out there and they're actively going to look. And what's going to happen is when this person meets the trainer and him or her mesh, they're going to come back in 3 months. Doctors say, how are you doing? They're going to be, great, guess what? I just lost 30 pounds. Doctor says, oh yeah, well let's run these tests. Comes back, see me in 2 weeks. Comes back, oh my gosh, guess what? You don't need medication for your diabetes anymore. No more glipizide. Your blood sugar is way down because you've been active. Guess what? We're going to reduce your medication for your cholesterol. Your hypertension is down because you're active. And that patient's going to say, oh my gosh, this doctor didn't just give me medication. He gave me a new way to live. He suggested a better way for me to live. And it's changed my life. And he's going to say, instead of this doctor, he's going to tell his friends and his family, instead of a doctor just giving me medication, he said, hey, go change your life. I did. So we went over, we talked about the need for exercise, the risk for cardiovascular disease and obesity. We talked about differences a trainer can make, and we discussed the 5 components of fitness, that a trainer can provide. And we identified how to find the right trainer. All right. So again, mainly what I'm looking for you ladies to do is remind your physicians not to just suggest, and even yourselves, say you need to go do it. You need a personal trainer. I'm going to finish off with a final story of somebody I trained. And so I've been working with this guy, and it's just recent. And so he's about 80 years old, Roger. And so he's got a bilateral knee replacement. So both of his knees have been replaced. And he's got a hip replacement. So when he came to see me again, he was on all sorts of medications. He's on about a total of 10 different medications for heart disease, high blood pressure. He was also on blood thinners as well. So he's been told, hey, you have to change your lifestyle. He's like, I'm 80 years old, right? I'm 80 years old, what am I going to do? It doesn't matter how old you are, you can make a change, right? You can change. So Raj and I, he comes over, sees me 2 times, sometimes 3 times a week. I give him programs of cardio programming. We train. I give him appropriate training, given the restrictions, his mobility ability. But in the course of the year that I've seen him, Roger, this 80-year-old man who was on 10 different medications and he's on a blood thinner, he's off of everything. He's on Coumadin, doesn't need it. He's on multiple medications, diabetes as well, done. And he's 80 years old. He's able to make a change in his life. And it's just the main thing is that you got to remember that you have to move it if you want to lose it. All right. Thank you guys very much.
Thank you.
Thank you.
Thank you. All right.
Very good.
Yeah.